Thank you so much for joining us today. The Pathways to Sustainability webinar series is going on this whole month. We talk about the community-rooted organizations that have evidence that their programs and services are effective at protecting positive birth outcomes. So we're really proud to show off the work that the Safer Childbirth Cities are doing. I think this is really, one of the vehicles where ANSHIP is shouting from the rooftops that the Safer Childbirth Cities are doing amazing work and that we're so proud of them. This specific webinar series, I don't know if you tuned in last week, but if you did not, this specific webinar series is about how these organizations, whether they're community rooted or community based, are working to create sustainable pathways for themselves and the programs that they've developed. So we are hearing from a variety of organizations this whole month on Tuesday. So if you only signed up for this one and you really enjoyed it, be sure to register for the rest of the series. It's always at the same time, 3 p.m. Eastern, 12 p.m. Pacific. Today we only have one presentation for you, so it's only going to take half of the hour. Our main theme today is about developing a community engaged communications campaign. I'm proud to introduce to you Tamala Milan Alexander, who is the Director of Community Engagement at EverThrive Illinois. EverThrive Illinois has a long history of engaging communities throughout Illinois for birth. Tamala is the Community Engagement Director, and she's been working in the field for over 20 years and is a former board member. She's involved in the current policies governing the health of all Illinois families. She also sits on the board of directors for Health Connect One and the American Academy of Pediatrics and Family Partnerships Network. Tamala has appreciated the opportunities to represent Chicago Foundation for Women Wells Warrior Fellowship, Mama's Voices, the ILPTC, the NICHQ, NBEC, and other coalitions and quality improvement efforts. She also supported work with Today's Black Child, Bright Futures, Institute for Patient and Family-Centered Care, City Block, and the American Academy of Pediatrics for various quality improvement initiatives, as a noted patient advisor, like with Bright Futures HAF project. She completed her master's degree in public policy and administration from the National Louis University. I'm so happy to introduce Tamala, and we will spend the next, I think, like 20 to 25 minutes hearing her presentation. Please feel free to add your questions in the Q&A or the chat. Salome and I will grab them up. And then at the end of her presentation, we will ask Tamala all your amazing questions. So I'll let Tamala take it away.
Thank you so much. I am so excited to join you all today. One of the things that I'm so grateful for and proud of is the work that EverThrive Illinois has been able to do to be transformative in this space. So what we're going to do is we're going to talk about how we've used this particular funding to develop a community engaged communications program. Next slide, please. Our team at EverThrive consists of myself, our communications manager, Deanna Panda, and Taliba Johnson, our community engagement manager. About EverThrive. Our mission at EverThrive is to achieve reproductive justice in the healthcare ecosystem through community-driven partnership, policy action, and systems change. And our vision is a just and affirming healthcare ecosystem where individuals, families, and communities can thrive. And our values are centered on reproductive justice, anti-racism, centering the most impacted, bold, and transformative action. So our Safer Childbirth Cities Project, we started off collaborating with the Chicago Collaborative for Maternal Health. A little bit of background. The Chicago Collaborative for Maternal Health is combating the maternal mortality and morbidity crisis in Chicago by first building awareness in communities and government, fostering collaboration among health and social service providers, and driving quality of care in ambulatory care settings. The CCMH envisions a Chicago where all people in all communities thrive because healthcare providers, policymakers, community organizations, individuals, and families partner with intention to improve maternal health. We had 3 aims. Our first aim was quality improvement, or QI as we affectionately call it, which is to lead a quality improvement collaborative to improve healthcare quality for pregnant and postpartum people receiving care in outpatient clinics. Aim 2 was based on our community to implement a community engagement effort to build awareness about maternal mortality and morbidity and prevention and empower individuals and families. Aim 3 around policy was to advocate for policy and system change to sustain improvements to health and, next slide, please. As part of Aim 2, EverThrive Illinois worked with community members and partners to develop and implement a community engagement campaign to promote maternal health and improve trustworthiness of healthcare systems. What was our process? So we did a community needs assessment. Then we engaged the community, and we did that through having focus groups on the west and south sides of Chicago, based in the communities. And then we trained over 100 social service providers after we implemented the campaign. So we went from community, engaging the community, to also engaging our providers. And then what we ended up doing after doing all of that is came up with a community responsive health campaign, which we affectionately called The Gathering. And once again, our guiding principle here was that people with lived experience are essential partners in identifying barriers to care and transforming the healthcare system to better support pregnant and postpartum people. This is The Gathering. When I first came, I've been in this role a little over a year now. And one of the first things that was one of my duties was to come up with the gathering. And so since we centered the focus groups on the west and south sides of Chicago, it was really important to us to have a visual that was really important in how we disseminated this information in the community and what that looked like. The plain language. We used a lot of the focus group feedback to present this and analyze the themes that came out of those focus groups to come up with the gathering. And really the gathering is just a way for folks in the community to support their self-care during pregnancy and after having their baby, but also it was critical with this campaign to make people aware. Also on our provider side, to give them an opportunity to understand what it is that is very culturally based in some of those in communities of color, especially, and also what they're hearing, giving them an opportunity not to be very dismissive, but to understand that there are language barriers and they're not always foreign. And so as you see here, there's very nice, it's not your regular, as I like to call it, stock photos. We were very intentional about that, and also making sure that people understood once they got this campaign that this was about empowering folks on both sides of the aisle, empowering providers to understand what they're hearing from community members, and for community members to be a better advocate, not just as patients or birthing people, but also information that they can give to family and friends to support them through this process, whether that be physical, mental, emotional, or helping them connect with different resources within the community. Once again, we trained over 100 plus social service providers on maternal mortality and morbidity. We did that through grand rounds. We presented at AMCHIP. And so we've used this information to really push the needle in trying to make sure that the campaign that we came out with is a model that is based on community. We increased our understanding of community need through the 330 surveys and the 4 focus groups that we did in priority neighborhoods. Like I said, those were on the south and west sides of Chicago, in neighborhoods that are entrenched in maternal mortality. And once we developed the Gathering campaign, we were able to disseminate it once again to help through healthcare providers, through 10 hospitals and clinics, gram rounds. We've reached over 35,200 people virtually and over 30,780 Black women on the south and west sides of Chicago through our peer-to-peer outreach by outreach workers from those communities. We have outreach workers who we contract with through EverThrive to go out into the communities, and they are going to the nail shops, the barber shops, they're going to residential, door to door, gate to gate. They also were able to go to different businesses and really share out some of this information that also reaches people throughout the community that are not the normal purveyors of healthcare. So what is our definition of sustainability? The Gathering campaign is familiar to and utilized by key birth equity stakeholders across Illinois. We have staff and capacity to support campaign promotion, content development, and editing to remain responsive to community needs. Our outreach workforce capacity to engage community members in one-on-one conversations about maternal and mortality is really important because they really are those committed, trusted folks in the community, and they can really talk about steps that they can take to support their families by having them not only get this information and learn about what's going on in their backyard, but also how they can get additional resources. That the resources to develop a toolkit and print materials for community-based organizations and clinics were provided and still ongoing. And then we have also evaluation to ensure the relevance of the community work that we're doing. The sustainability domains that we are participating in: active and communicative partnerships statewide. So we develop meaningful bi-directional statewide partnerships. That takes time, of course, and resources. But our community-based organizations, hospital and clinics have limited capacity to take on new initiatives. And so that's why it's really important for us to continue to work with our community stakeholders to get this information out. State funding streams and financial resources, another domain. Federal funds typically do not cover 100% of the program and direct costs, which is limiting of our operational grants. And increasingly, grants renew every 1 to 2 years, inhibiting really long-term planning. The other domain would be continuous quality improvement and evaluation. Currently building long-term academic partnerships to strengthen our evaluation capacity can be challenging to engage during these very short grant cycles. And when grants awards are small, we typically allocate more funds towards programs and community need rather than robust evaluation. And then benefits to community and users. It is our long-term goal to strengthen regional presence to reflect geographic differences in campaigns, which we're currently working on. And then we would like to build out the campaign to address multiple community needs, like expanding resource sections to be responsive to local conditions, because every community is different, and we know that. And also like expand our sections aimed at not just giving them a bit of information on how to support those birthing folks, but the caretakers and the fathers who may have to take on a more extensive role and who have and don't have the benefit of information targeting them. One of the ways we want to do this project aim is to expand the reach of the Gathering by disseminating the campaign to healthcare and community-based organizations in Central and Southern Illinois. We plan on doing this by engaging 6 organizations to join the Gathering campaign, who will commit to disseminating materials to 600 families. We'll host 6 listening sessions focused on expanding the Gathering to respond to regional needs focused on perinatal mental health. Like, how are folks accessing resources? What are those resources? Or are there not resources? And so that a lot of this can be tailored to be very tangible to those regions that we're reaching out to. And then we're going to train an additional 22 community leaders on the gathering to disseminate the campaign in their community statewide. How do we know we will be successful? Measuring success. 90% of the central and downstate health and social service providers committing to disseminating the gathering to their patients, clients, community members, and their networks would be a certain sign of success. And that's putting that knowledge in the hands of the folks who need it the most. And then increasing the number of health and social service providers, sorry about that, not enough coffee, using the gathering by 600 in our Edwardsville and Champaign-Urbana area. And those listening sessions should result in 4 concrete changes to the gathering campaign, increasing region-specific content. Our gathering is very, very organic, and it is our hope that it can be very tailored and be very, for us to be very intentional about how we disseminate in certain areas. This is not a cookie cutter process. What we hope will be different after our project, we'll have an expanded and deepened relationship with birth equity leaders in Central and Southern Illinois, who will not only promote the gathering, but they'll join our network of statewide partners. Expand the health and social service provider understanding of language used by community members to describe their lived experience during and after pregnancy. One example of this, and I like to use this because I think it's important, when one of our patient partners shared that when she says that, you know, she's having a setback, and the provider said, oh, a financial setback, you just had a baby, that's quite understandable. What she meant was there are medical things, poor healthcare things that were a part of when she said setback. Well, if you're not from that community and you don't understand that, then that's a barrier, right? Because this person is saying, I feel like I'm having a setback. Well, this is something that's a term that's used in our community, but she may not know how to say, you know, hypertension. She might not be able to say a lot of those clinical terms, but she knows something is wrong. And that person can be quite dismissed when the language is not understood. And so we have a glossary of terms that's connected to the gathering that we think is very, very important and impactful in how we do this work. And that's just a way for us to continue to think about terms, whether it be Chicagoland or any different, but including those terms is really important because terms mean different things to different cultures. And then increase community awareness of the maternal mortality crisis and how to prevent it in our downstate region. And also our increased understanding of the regional challenges to improve the community health and social service providers in those communities. In conclusion, the external factors that are involved in sustainability, increased number of maternal deaths in Illinois due to mental health and substance use, that's a big part of what's happening. And of course, the limitation of general operating grants. It's just, we see these rates increasing, and that's just a huge factor in why it's so important to continue and grow this work. And what would accelerate our success in this area, of course, would be long-term investment in the campaign, using our networks to amplify the campaign, and then, of course, a multi-year general operating fund to nimbly and sustainably respond to and address the maternal mortality crisis. And I want to thank you for the time that you provided me with today, and I am open to questions, and I'll come on screen for that.
Thank you, Tamala. I think we do have questions. And I'm also going to be throwing into your screen, you'll start to see a poll. And we just want to get your feedback as well on, for those who may not be able to stay for the Q&A, on any feedback you have around our Pathways presentation. But Tamala, thank you so much for sharing about your campaign program. And I think I saw one come into the chat. And so one of the first questions was, how do you keep messaging positive and not fear mongering, like many headlines that highlight Black maternal mortality, which can be very scary to read about?
The problem is most times in the community, they're not scared because they might not even be aware that this is happening. If they are aware that something's happened to someone who didn't return home, they may not recognize the gravity of what's happening in the community. And so for us, our role is to make sure that folks understand that this is very preventable. And you just need to, take a look at some of these ways and be advocates to your care. Be very strong advocates to your body, what you're feeling, and what you need to do. And so that's how we promote. That's the positivity of it, right? This is something that potentially can happen to you, but what is our focus? Our focus is to educate them, because a lot of people just don't know on the west and south sides and many parts of our downstate region, because I think we don't hear about it. It's not a part of a regular conversation that happen at kitchen tables in BIPOC communities a lot.
Yeah, I think that that's a great question because that is something that we see so much when it comes to media, and we live in such a media generated world, and so really intersecting um, campaigns like The Gathering in the world that we live in, but doing it in a positive way is really important. Um, I'm looking to see if there are any more questions. Okay, cool. We have a couple more that came in. Will the slides and recording be shared? I believe that I don't think that we will share of the Q&A section, but we will definitely, I believe we will be sharing the slides. So I will definitely get that confirmed, but yes to that question for now. And then the next question was, can you expand on the town hall sessions? Who will attend and what do you hope to achieve?
Well, any community stakeholder, we're promoting this throughout the state. And what we wanted to achieve is really knowledge. And we know that knowledge is power. And we know that so many times that the folks, those community stakeholders, which includes providers, it includes those birthing people, but we also recognize that if they don't know about us and don't know that we have such a powerful tool to be engaged in, I mean, we have downloadable opportunities for providers to take, for example, at glossary of terms, to be aware if someone says the word sugar when they're having a conversation. Well, sugar runs through my family. Well, we know that to be diabetes, but if someone who's not been purview to that may not know that's something that shouldn't be dismissed because you may not understand it. And so it's up to us to be a part of enhancing those opportunities to share this information, and for the families that folks are serving, that you can use this campaign and these resources to really help guide a conversation with those birthing folks that you're engaging with. So that's really important. It's about getting folks out there to understand that this is a tool, and it's a very community-based tool. And it wasn't built from the top down. Is built where we all were a part of that conversation. Excuse me.
Thank you for sharing. And the next question, kind of going into that, what you just shared was, what other barriers were identified in the focus groups?
There were a number of themes that really went through there. We didn't address every last one of them, but the other part of the thing was access, right? Access to services. We know that in the Chicagoland area, there are a lot of maternal deserts, a lot of hospital closures throughout the state, and a lot of times people don't have access. They have to go to this one place, even if they've not had respectful care. And that puts them in a position not to want to advocate because they don't feel they have choices. And so that's one part. of what's going on. And one of the continuations of the work is to think about where are the gaps? Like if you can't go anywhere for care, our downstate partners are saying folks have to go across city lines to get adequate care. And I say that adequate because people might be willing to travel. And then there's that barrier where they don't have transportation, because there's a lack of transportation in those areas, especially if you have to go to a high-risk clinic. There's no high-risk clinic in your county or your town, or in your neighborhood, and you have to go to a different neighborhood, a different town. So all of those are barriers that we heard of, and accessing how folks access. Like if I can't get to it, I can't engage in it. So the only place I can go is where I feel like I've been disrespected, or I can only go here because this is the only thing that's available. I've always heard, don't tell me about my choices when the choice I have is one. And so that's a barrier too. We know there's a lot of disinvestment in some of these communities, and really it's a barrier because there's not a lot of other choices in where folks receive their care. So we did hear a lot of that, just as one to share with you. But there are others.
Yeah, and even thinking about for those that are insured, like there's still barriers in care of who, the type of providers that they can see, and the location of
Exactly.
hospitals that they can see.
Exactly.
Thank you for sharing that. The next person says that such great work. Thank you for sharing and asking where they can find more information on what the gathering is. We will be sharing, information on how to reach out to Tamala and reaching out more about EverThrive as well. But if you want to throw into the chat a link to the website, I can also link your website into the chat for you.
Thank you.
Yeah, and so I'll do that. I'll link your website, and then we'll also be sharing more information on how you can reach out to Tamala. And so I guess that answers that question. And then the next one is, what is the opportunity to collaborate with medical education and other healthcare training programs in Illinois to teach providers about language used in community before they are providers?
I think that's an excellent question. I think what we would hope is that as we do grand rounds and do webinars and ask people throughout this ecosystem of healthcare, that we have an opportunity to be a part of those rooms with academic partners or potential partners to really think about that language. I think it's a big part of the barrier that it leads to dismissiveness and folks feeling disrespected because of the dismissiveness. And so it's really important to me that we really think about comprehension, the health literacy of folks. And that can also be just as big as a barrier. You can tell people, listen, look out for these different symptoms, but if it's put in language that folks don't hear every day, your hemorrhaging is different than heavy bleeding. And so it's really important that we take our time and intentionally think about how we're developing conversations with folks in the community, no matter what culture they come from. But I would love to see that moving forward. But that's why we're here thinking about sustainability. What does that look like, and how can we go into places where it will make a difference before they get into that room and deal with that, engage with that patient.
Thank you for sharing. The next question, how have you utilized social media and virtual spaces to engage communities on the Gathering campaign?
As I shared, we've had over 35,000 folks come to our landing page, and we've done that through promoting it through our webinars, through our social media. We have a phenomenal communications team, which is a really big part of the work that we do. And once again, we also engage in community health workers who are trusted members of those communities. If you are a part of the West Side, we got West Side folks out there. They know where alleys to go to. They know where stores are at. I'm just, and so using those folks and having those folks be our partner and contract with us in those communities was really a big part of it too, because they know where to drop this information off at and direct people to use the QR code. Listen, I just learned how to use a QR code a little while ago. I was like, I'm not using my phone. It's going to get a virus. You know, I had a whole thing, like, I'm not doing that. And so it was important, right? That if you're the trusted person, like, you can take this picture, but it's going to lead you to these other websites. And a couple of our community health workers came back because they're like called like the baby lady, right? Because they're out there giving this information about how to save lives and how to impact them and what to look out for. And so that's a big part of it too. But we're putting it out there in the communities where, once again, this is not the language of the community, but it's so important because it's happening, because you don't know why this person didn't come home and they went to go have a baby. And they don't know that's maternal mortality. And they don't know it's a crisis in their backyard. And that's how we do it. So I'm really grateful for our comms team. And I'm very, very grateful for the folks that we contract with who are knocking on doors and talking to folks at bus stops and doing what many of us would love to do. So really grateful, really thankful for the funding to do that.
Yeah, I can definitely say I do miss doing outreach work as well. And I guess this might be the last question I'm seeing, but the last question, and feel free to continue to throw into the chat in the Q&A, but Hannah says that this is really incredible work. Thank you for sharing, and just asking, can you talk a little bit about the different social service providers you trained and how did you identify and recruit them for training?
Absolutely. So of course, we wanted to target our health and hospital systems that are a part of, you know, birthing hospitals and such. So it really wasn't hard to recruit because I think everybody wants to understand how to do this better. And so that was an opportunity for us to share with FQHCs, especially because FQHCs are our community clinics are a big, they take up space in those communities. And so we were able to work with a lot of them, Healthy Start programs. I'm myself an old Healthy Start person. I worked with Healthy Start for over 17 years. And so once again, those grand rounds with Rush Hospital, Stroger Hospital, those who are, all of us are sort of all connected in trying to improve the maternal mortality crisis. So it wasn't a hard lift, but it was good that this was based on community feedback. And I think that was the interest, to hear that this particular work had a lot of feedback, not only just from the folks from the focus group, but also different providers that were community-based organizations or they were in the healthcare system, but thinking about how we're not making the intersections that are necessary really to provide the best care for folks in different communities, and especially communities of color.
Thank you for sharing. I think, like you said, leveraging the current partnerships that you have and really working together, can really be beneficial.
The usual suspects, as I like to call it.
Exactly. And I am not sure if we have any more questions, but also just want to remind folks that the poll is up. We still have 48 people on, and so if you see it, please feel free to answer those questions. And like I said, we will provide these slides and ways to reach out to Tamala after this presentation. But I mean, I don't know if there's anything else. Oh, do we? Oh, no. I don't know if there's anything else you want to add, Tamala,
Sure.
or share
No,
before we close out.
Yeah, I definitely want to just make sure that the part of the campaign, once again, that is very unique is because the community voice and everything that we do at EverThrive is really focused on using the community voice to build out these different campaigns. It's nothing that we don't do without either engaging with, we have a maternal and child health family council. So they were a part of that, going into those communities. I mean, one of our focus groups was at a FQHC, the other one was at a beauty shop. So we make no judgments in how we get this information, but once again, it's always important to educate communities on what's affecting them, because sometimes we are not aware of the disparities. We just understand when we hear this from our community, we just understand that it's happening to us and not them. But what is happening to us? And a lot of people don't know what that is. And so I feel like a part of our vision is to make sure that they know that. They know what's happening, because Black women in particular are 6 times more likely to die. And why? When it's so preventable. And so our campaign really is, to me, an opportunity where there is very little to share, educate, impact, and improve conversations across the board. And so I encourage everyone to go and look up our digital campaign. We have our landing page. We have during your pregnancy. We don't use words like postpartum and like your pregnancy, and after you give birth, and family and friends. Like, how do they help you? Do they know who your doctors are? If something happens, how do they navigate to get you what you need? And then, of course, our glossary of terms for doctors and clinics, I think is imperative, it's impactful, and it's powerful. We have social media graphics, and then we have a gathering video just that we shared so people can know that they are heard, and they are important, and they are valued. And how do they do that?
Yeah. This is, I can foresee this tool being amazing collaboration, even with birth workers, as you continue your work. And so I'm
Definitely
excited to see how the campaign really continues to expand even outside of Illinois, and kind of the method can still be replicated, outside of Illinois.
Oh, I
And I
did.
guess,
I mean, you said it. I didn't. Okay.
right. I'm just saying,
You said it.
there's always room for partnership in this work. And so
Oh
it's
my God. Yeah. Because the language here is going to be different in Arizona. They may have their own way of saying,
exactly,
I go down south and talk to my people all the time, and there's a difference between pop and soda. If I go
exactly.
to my auntie's house in Colma, Georgia, and I say, "Can I get a pop?" She'd be like, "No pop here."
Exactly.
I have to
Yep.
say, you got a Coke. Oh, you want a soda? So, I mean, it's that, she had a whole case. I was about to be running around deprived of a soda because I said
Yeah.
it wrong. So I just think,
Right.
I'm lighting the mood, but we know sometimes it's not who's saying it, but how we're saying or what you're saying can be the difference between getting help and not.
Mm-hmm. Yeah. Well, I think that's a beautiful way to end today's call, and have us really thinking. And even, that's something that even on AmChip's side that we are going to be even launching at the end of this week is a learning bundle on harm reducing language. And I think that's something that, Tamala, you get at, is really learning how to utilize harm reducing language. And that's just language that is what everyone speaks, what the person with the lived experience speaks and can understand. And so I just want to thank everyone who came and attended. And also thank you again, Tamala, for just really being here and sharing a little bit about your project and your work with Safer Childbirth Cities initiative. We
Thank you for
will,
having me.
yeah, and we will definitely share out that information. And I will end the poll now as well and give folks back that 20 minutes. Yeah, thank you all. I hope you all have a good rest of your evening. All right. Bye, everyone.
Bye. Thank you.